predicting how long a person's prognosis is and also how long a treatment will work requires judgment that includes a number of factors. One is you look at the extent of the disease in the patient and which organs are involved. So, for example, if there's a lot of disease in the liver, that's not a good sign. Also, the speed at which the disease is taken to develop. If it's developed slowly over a long period of time, then we call that a slow trajectory. If it's moved very quickly and the patient's sick with the disease and has lost a lot of weight, then that's a bad sign. So those are some factors we look at. And then as far as the treatment's concerned, we look at the clinical trials and we look at what we call median survival, which is where half the patients survived until. So what I try to say when a patient says, how long do I have on a treatment? I use the median. I say, well, there's a 50% chance, according to the trial treatment, that you could survive to this point. Or we might use what we call a landmark figure. So we say, what are the chances of surviving to a year or longer? And are there people that have survived beyond 2 years? So that's the way I present the statistics. People find it hard to understand about reduction in risk of death, things like that, but it's easier to comprehend what are my chances of being alive in a year? And that's how you put it to the patient. I discuss treatment options for metastatic gastric cancer as soon as I have a patient referred. There's a bias because the patient's referred to me to discuss treatment. But sometimes you might find that patient's not well enough for treatment. But in the majority of cases, I said they wouldn't be coming to see me if they weren't either seeking or well enough to have treatment. So the discussion starts at the very beginning. And we usually talk about what we're going to do first. That's first-line therapy. And I try to look at a patient in front of me and think of what's their option list going to be going along. Because obviously, if every treatment you have up your sleeve produces an extension of survival, then that's going to give the patient the best chance long term. In regards to clinical trials, the important things for a patient are to consider them as an option. Sometimes a clinical trial might be evaluating the best way to deliver treatments we already know work. Or you have a clinical trial that's investigating the addition of a new therapy to try to make outcomes better. So I think it's important the patient feels comfortable with the trial as an option of therapy. And sometimes it may be an additional option where no other option exists. They're particularly attractive to some patients. And always I say to the patient, you've got to go in there with the hope and belief that this is going to be helpful to you. Otherwise, with anything that we do, you shouldn't really embark on a treatment if you don't think that way. In regards to what's the best treatment option for a patient, clearly I see my role as providing judgment and experience around the evidence. Where there are a number of options, and I may present those to the patient and involve them in the discussion. I always try to ascertain what's the most important thing to the patient. Sometimes that decision's easy. The cancer's bad, it's affecting them greatly. So I would then propose a treatment that's going to have a better chance of shrinking the tumour quickly, making them feel better faster. If, however, the disease is smaller, not affecting as greatly, and therefore I might use a gentler treatment to minimise side effects that allows them to live more comfortably but without creating side effects. So that's how you tailor the treatment. The work that the GI Cancer Institute and the AGITG does for patients with metastatic gastric cancer is to try to address questions that are of value to the patient and to us as clinicians. Most of the questions that we come up with for the conduct of a trial are often based around things we see in front of us. So we try to have clinical trials that have relevance in the clinic and to the patient, prolonging life, maintaining quality of life, etc., changing the outcomes in a positive way.